So today we are going to do intramuscular medication. Please note, you must always know the action, special consideration, safe dose range, purpose of administration, and adverse effects of the medication to be administered. You must note that the basic principles in medication administration must always be maintained by covering the 10 rights and 3 checks. Your 10 rights are right patient, right medication, right dose, right time, right route, right education, right to refuse, right assessment, right evaluation, and right documentation. Your 3 checks. The first check is when the medication is pulled or retrieved from the medication cart. The second check is when preparation of the medication for administration takes place. And the third check occurs before medication is replaced in the trolley. Always complete your assessment before administering medication. You would gather your equipment, which is additional PPEs if needed, medication, the sterile syringe and needle, sterile swab, your doctor's notes and your nurse's notes. You would perform your hand hygiene. You place the medication cart in front of your patient's bed, also making sure you are facing your patient at all times. Note, always prepare medication for 1 patient at a time. Identify the patient using methods. Check the name and date of birth on the patient identification band. Ask the patient to state his or her name and date of birth based on hospital policy. If the patient cannot identify themselves, verify the patient identification with a staff member who knows the patient for the second source.
This was all done previously.
Check the patient allergies or bracelet, or ask the patient about their allergies.
This was also done previously.
Discuss the various sites for administration of intramuscular injection.
There are 3 sites. There is the deltoid, there is the thigh, and there is the upper outer quadrant of the gluteus.
Select an appropriate administration site.
So we are going to use the upper outer quadrant of the gluteus.
Assist the patient to the appropriate position for the site chosen.
So I've already spoken to the patient and we have selected the appropriate site that they are comfortable with.
Drape as needed to expose only the area of site being used. Cleanse the area around the injection site with sterile swab.
And I'm wiping in a circular motion.
Displace the skin by pulling the skin down or to one side about 1 inch, 2.5 centimeters with your non-dominant hand and hold the skin tissue in this position. Identify the upper outer quadrant of the gluteal muscle.
Right, upper outer. I'm using this piece of swab as a direction.
Stick the needle into the tissue at a 90 degrees angle.
My bevel is up, going in at a 90 degrees.
Pull back on your syringe, making sure no blood is present.
I've pulled back, there's no blood present.
Once okay, inject the medication from the syringe into the patient. Remove the needle and apply pressure with a dry gauze. Never recap needle. Place needle in the appropriate receptacle. Assist the patient to a comfortable position.
Okay, patient is comfortable.
Perform hand hygiene and document. And that is the end of intramuscular injection.